in my life, but I think this is the one where I feel the most nervous. So please help me, okay? To relax, because I want to enjoy. So let me start this keynote just with the end, what usually we have at the end of our presentations. I want to start with this one, the thank, because I think, I am really overwhelmed by all your words, and also about the review of all the different research lines, different findings, different contributions that we have done, but also about the wideness of the perspective that the previous speakers have already presented. So first, my thanks is to the speakers that have taken their friends, I know, and I'm really very happy that you have been here and you have shared with us your thought and your work. And then I needed to thank also, and especially the group at ARC, all ARC people, the MVS department. Do we have here, Maria, are you still here? Yes, MVS, thank you. And the academies in general, and that I thought we have also some representative from KI. The director and the head of ARC especially, but the students, the researchers, the technical and administrative staff. Is really a pleasure to work every day there. And I want to also thank especially the group that I call M7, the Magnificent Seven, are the people that are the closer collaborators that I have now at ARC, that they are, I think, the people who have worked mostly for this symposium, together with the organizers. I don't put names so I don't do any mistake, and but I thank all of you. And this, I guess, I finished. Thank you very much. Okay, when I started to prepare the presentation, I noticed that it was not the title. And then I thought, okay, then I'm free, I can do what I want. And I started to think that there will be a lot of findings, what we have done. Why not to think about the future? So looking at the future, this is my invitation with you. Shall we think together about the future? Because this is the most exciting part. And when I speak about the future, I have immediately 4 questions. What shall we expect? What can we bring to the future? What can we give to the next generation? And what will I do myself? And of course, all these questions are related to our work. I'm not thinking about other things that are even more important maybe in this moment in the world. I'm thinking about our research field. And what shall we expect? That this was not very difficult for me, because there is immediately a fact. Until now we have heard a lot of speaking about demographic transition, but now what we will have, and we have already, is an expansion of the demographic winter. And for demographic winter, we mean a phenomenon characterized by decline in birth rates and increased population aging. So this is a fact. We don't have to think about anything else. And you know very well that the people over age 60 in the 1950 were 8%, and now we are up at 21%. And then the question that I gave to me, preparing the presentation, what is my vision, given that this is a fact that we will have to face? And my vision is summarized in 3 points, and all people here knows how much I like the number 3. Number 1 is that we will see different attitude towards aging, because we, the older adults, will be more and more. This will also lead to more acceptance, to have a decreased discrimination, and older adults will be viewed as a resource and not as a challenge, as we are speaking always now. There will be an increased relevance of aging research, because there will be more demands for solutions from the scientific world, and then there will be also more investment. And in research we need always a good budget for doing something. And the third vision that I have, that there will be an extraordinary advancement in science, because I'm sure that will be fantastic in advancement in diagnostic, treatment improvement, increasing scientific evidence applied to the healthcare, including medical and social care, and it will be an extension of health span through prevention. This is my vision. I'm sure that will be this. And then I'm sure that you will, it was too much. It will be, you will say, Laura, you are too optimistic. It's true that I am an optimistic person, but I don't think that I am optimistic. And I can tell you why. It's because there are two citations that I want to take with me. Is the fact that somebody else, some years ago, and this is Eleanor Roosevelt, who maybe you remember was the wife of Franklin Roosevelt, the President of the United States, but a very famous woman for defending human rights. She has been also delegate the UN, and she said, "The future belongs to those who believe in the beauty of their dreams." So if you think that my visions are dreams, the future is mine. And I will come back to these key words, dreams and beauty, because I like this a lot. The other citation comes from The Old of Time, a book of a physicist, Carlo Rovelli, an Italian physicist, who is really writing a fantastic popular book, but with really solid scientific background, and becoming, as a lot of physicists they do, also a little bit philosophical. And taking this Carlo Rovelli, I take it's a citation from him. It's my own translation, so I don't know how much is. It's much nicer in Italian. Il tempo non è una linea che scorre, ma un intreccio di storie che si svolgono insieme. I don't know if my translation is. Time is not a line that flows, but a web of stories that unfold together. If this is true, and I believe completely, this means that the future is already here. So my vision is not something that I am doing a prediction. I am based my visions on the present. So this take me to the second question. Then if the future is already here, what can we bring for the future, for the future from the present? And this is my summary of most of this has been already discussed and presented today. So I don't have to spend so much time on that. But this is my summary of these 50 years of scientific progression related to our field, dementia and aging, or shall we say health and aging. I think what for me, especially as a neurologist, my background is in neurology, has been fantastic is the advancement that we have had in the diagnostic tools. Think about neuroimaging. I mean, when this 15 years ago, I was a medical student at that time, I mean, we didn't have, we started to have CT at that time. Nothing of MRI or PET. It's unbelievable, the progression. And it is the same, it's unbelievable, the development within biomarkers for early diagnosis of the genetic knowledge that we have in through the sequencing. And this has helped a lot to do better clinical work in geriatric medicine. But the advancement in geriatric medicine has been also because new concepts have been developed. They have been able, I mean, and this I say because I'm still, I am in the geriatric field as a researcher, but I respect the geriatricians, that they have visions that in other disciplines we do not have. It's the fact that they have been able to show the specificity of the geriatric medicine and the complexity of the health of the older adults, and then establish really clearly the need to work with geriatric syndromes. This is an exceptional advancement at the conceptual level in the clinic. Of course, this development has provided also what here I call a neuroscience, a progression in neuroscience, and of course this is, you know, as neurologist, let me take at least once the word neuro, but I could have written brain aging research, for example. And because the advancement in our knowledge how the cognition and the cognitive performance will develop during aging outside diseases has been extraordinary. And the same, the knowledge of the pathological background of Alzheimer's disease and other dementia. And then the last maybe 10 years, we have been the new perspective with geroscience, with the work that we have already heard. Just Patrizia Mecocci has shown to us the hallmarks of aging and the cerebral senescence. And finally, the field that maybe is closer to my work with the geriatric epidemiology, the advancement in prevention. We have now identified preventive strategies that allow Miyake Piperto to do this worldwide thing. It's unbelievable, fantastic. And we know that the healthier aging is already in act. I mean, you just look around, look at me, I mean, I'm a healthier older adult. Okay, and then we know that we have to be better with the health span, but this word health span is now starting to be everywhere. People, not only in geriatric medicine, are speaking about health span. So this is the summary for me of these 50 years, that this is what really the new generations, the knowledge that they can use to go further. And and if we want to go a little bit more in the specific, please let me use, I think, 3 slides for showing our contribution to this progression. And this, when I say our, it means that also my work, but especially my major message at the beginning is the fact that all the work that I have done in a team. I mean, people has been fantastic in doing and achieving this major contributions. And the people, for example, in ADARC, because this is the group where I am speaking about, they have been able to work with these geriatric syndromes, especially multimorbidity, frailty, and falls. And I will, of course, mention only the PI of this research line here, and there especially Anna Corinne Werner for all her work in identification of the people at risk for falls, and Amaya Calderon for multimorbidity, and Davide Vetrano for frailty and multimorbidity. But what these people they have done, they have been able also to show that there are different health indicators. So we were speaking before about how we can differentiate persons with different multimorbidities, same number of diseases or same type of disease pattern, but different impact on their health. It's because we are able to have some index that summarize the diagnosis with the functioning, both physical and mental. And this is the health assessment tool of Amaya Calderon, Frailty Index of Davide Vetrano. And of course, I mean, I have to put also another picture here because, I mean, I have worked for 20 years with Alessandra Maringoni. You did a fantastic presentation, Alessandra. This concept of feasibility, enlarged concept of feasibility, we need to take up in one of our seminars. That is very important. But I have to go further because I want to go to the second point. And the second point is the fact that this life course perspective, we have worked with that for years at ARC. And here I have to acknowledge Deborah Rizzuto, that in 2016 she was putting a model that now you will call esposome, because now we have this new word even in geriatrics come. And this means that you have multidimensional factors that all together interact together and acting in different phases of life. So thank you, Deborah, for this work. As I have to thank other three persons, Chu, that you have, Chan Chu, you have already heard, Willy and Sergei Deviari, for the work concerning the cardiometabolic burden, middle age, and the protective factors. And here we have already heard Hushin speaking about this, so I don't say anything more, but I want to acknowledge these people. And all are working also on health trajectories, because this is the other novelty that you will bring with you, the next generation of researchers, the fact that health, especially in aging, after age 85, this is when start age, is not only a status, is a process, a dynamic phenomenon. And work with health trajectory gives a lot of possibility. And all other people, not only these first four, but Anna Cori and Amaya and Davide are working with this. So thank you again to these people. And thank to all these people. I have done all these, how many papers I have published until now? I don't remember. Okay, doesn't matter. Sorry. Thanks to all these people. This is what I want to say. They are the mind and the motor. And the must. Prevention and early detection, and this is the other big contribution that we have given to our field and achieving a healthier aging. And again, people on the back, I have Hushin for her work on cognitive reserve, we have heard, and that has been developed, this field, and enlarged to work with resilience in general, not only cognitive reserve, and applied also to mental health. Sergei, I don't see where you are. Oh, okay, thank you, Sergei. And then the primary prevention, of course, here I have to mention again Deborah Rizzuto, because I mean, her decision and really obstination to continue to work with environmental risk in spite of some problems at the beginning, it has been fantastic, and she worked with environmental risk, is very important. Anna Corin Venner for her work for prevention of falls. We have already heard Chu about his collaboration with Miyake Health for the Mind China, fantastic. And finally, I have to say two other things that are really happened in the last 5 years is the fact that now thanks to the work of Davide Vetrano, we have the possibility to have a fantastic biological examination in our population, and now we have the first results. The work of biomarkers of multimorbidity published by Davide, and the work of biomarkers in Alzheimer's disease, the blood ID biomarkers, and the predictivity of dementia. I really recommend you to look at the paper of Giulia Grande, just published in 2025 both. And finally, something that is really new on the line, and I attribute to all the merit to Amaya Calderon for the tertiary prevention. I know that you wanted to say also quaternary, but I am not yet there. But she is doing, I will tell you, she will do fantastic things. So this is our contribution that we have done in the 25 years of the life of ARC. But I couldn't stop without thinking also about my friends in the psychological group at ARC, because I have not been a motor there, I have been only a simple collaborator, but Lars Beckman and then now Erika Jonsson-Lauka have done a fantastic work concerning cognitive profile in aging, exceptional data. So then you will say, okay, the next generation can bring all this knowledge, but do we have something more to give to the younger people? And I'm thinking something a little more general than knowledge, and of course something that doesn't matter where you are or which is the topic that you are working with, something that is always valid. And I think we have developed a scientific approach that is really important to provide to the new generation. We can also speak a little bit about experience, because as usually I say, I like, of course you have to do your own mistakes, but please don't do at least the one that I have already done. Be original. And then we can provide also the method, the scientific methods that is important. But I want to go a little bit more further. I think we can, the people who has already worked for 50 years as me, we can give also hope and perspectives. I think about you were speaking about hope in your presentation. I like this a lot. And this hope and perspectives give me the idea to go back to my first citation of Eleanor Roosevelt about dreams and beauty. And you say, what does it have to do with dreams and beauty with our work? I think a lot. Shall we start, I think, with beauty, if I remember well? Go? No? Yes. Beauty in science. So, what is beauty in science? It's not something that I think. It's enough if you go and look in Nature, the issue of March 2022, you have a paper there, summarize how beauty and wonder helps the researcher to doing a good job. They have even done already a symposium in beauty and science. I was really astonished when I saw that. And what is all the starting point was from this study called Work and Well-Being in Science, where the group of scientists, they were a group of biologists and physicists, okay? They have been asked, what do you think about beauty in your work? What is that you consider beautiful in your work? And they have, as I said, shown different answers between the physicists that are the darker column and the biologists. But if you look at, I consider closer to the biologist, I think you too. But you see that we are both very happy with elegance, too excited by the hidden order that we want to discover, and then we want also to see the inner logic. But the biologists are especially attracted by the complexity, and this I liked a lot, because for us as geriatricians, complexity is really, in research, is what we need. And then the beautiful is how the world is symmetric, harmonious, but also complex. And I like also to tell you that 50% of the people thought, 57% of the scientists that have been interviewed thought that beauty improves their scientific understanding. And let me read this sentence. When we experience scientific insight, it triggers the same operation in the brain as musical harmony. And when we take pleasure in this insight, just like our art. I don't know you, but I have felt sometimes, not often unfortunately, but sometimes when I was able to, yes, this is the finding, this is the result, this is, this is also is the research plan that I want to do, to create an idea and to try to find the right message and so on. So beauty is important for us. And the other word that I want to is dreams in science. And here again, it's not my ideas. I mean, I can cite a pretty known person in the scientific world. And Albert Einstein said, the intuitive mind is a sacred gift, and the rational mind is a faithful servant. We have created a society that honors the servant and has forgotten the gift. And you understand? So don't forget, this is my own real direct message to the new generation, your intuition. Be free in your way of thinking, because this is what will bring you to have visions, new ideas, to have a research where innovation, novelty, and originality are the starting point. So, beauty and dreams, this we can give to the next generations. It's not only Stefania who had problems, it's something with this. Okay, so, but be careful. I don't want to be, to be misleading. After the dreams, there is hard work in our field, because a new generation have to do bring up new knowledge, new methods. We need new methods, and we will have new methods. Think about our artificial intelligence. We have to use that in the best way, and you have to do your own experience. But you have also to do what I call here anchorage. And I was so happy to listen to the enlargement of the idea of feasibility, because I have already this in my presentation. So you have to anchorage your research in the reality, but not only that, but also in solid ethical principle and in your own intellectual honesty. And for me, especially in this troubling time, it's very important not to forget. It's not trivial to remember that. Clarity, simplicity, and other important things that you have to bring with you in your work. Mental openness, you can be wrong. Often we are wrong. And this is because in science, in general, we have only one certainty. It's the certainty of doubt. And also that is not my own idea. You can read a lot about the certainty of doubt, but I advise you about this really nice book that is a tribute to Peter Mons, who died, a philosopher of the last century, really working a lot with the concept of doubts in science. This means that when we work with scientific work, we need to to learn to live with uncertainty, accepting that truth is a moving horizon and not a definite conquest. So maybe the things that we have said today, maybe, if we are lucky, 70% that will confirm in the future, but some of our findings will not be confirmed, are not true. And this again, I have taken from Carlo Rovelli. This is his last book. I don't know if it has been translated. Maybe not yet, because started in Italy. It was published in 2025. It concerned the equality among the sex. And he brings the concept of the truth that is moving always far away from you and you are trying to catch it. Okay, so then I have reached the last question. And how is with time? It's okay. What can I do myself? Okay, I want to put a little bit more. It's very simple. 3 points. Continue doing research. Continue supporting aging research, that is something different. And continuing fighting for the scientific thinking. I mean, if I have written this answer maybe 5 years ago, I would not have thought that I needed to say continuing fighting for the scientific thinking. But in this period, we have to really be careful and be clear that it is not acceptable to deny the relevance of vaccines. And we have heard this fantastic discussion of Stefania. But it's questioned. So continue fighting for the scientific thinking. And this is especially because research is part of our lives as human beings. All human beings have been researchers at least once in their lives when they were children. So it's natural. It's our way of being good human being. And this again is not my own words, but it comes from this man, a professor in pedagogy, Francesco De Bartolomeis, that I had the pleasure to meet in 2021 during the Healthy Aging Week, organized in Alba by Fondazione Ferrero. And when he spoke, he was 102 years old. So he has continued to be active and thinking about research until that age. I cannot promise that I can do that until that age, but it's an inspiration, definitely. No? So we are reaching to the conclusions. So we are really at the end. Some minutes more. Are you tired? So my conclusion will be personal and very personal. The personal is that my professional life has been more than a simple journey. It has been a lot of journeys, all interconnected. But the main denominator of all these journeys is the fact that I have met the right persons at the right moment. And now you have to allow me to show you at least some of these right persons that I met in the right moment. I have to say I will not speak again about the people that I have already spoken before, because otherwise it's a little bit too much. Okay. My professional life is very simple, 2 blocks. One in the University of Florence, and one where I work mostly as a clinician, but also as a researcher. Then my work as a researcher has been mostly here at Karolinska Institute, and always the same department that before was Neurotech. I don't remember what it was before Neurotech. Do you remember, Bengt? No? Okay, doesn't matter. But when Bengt was speaking about the 3 men in my life, and I agree with him that Tom is the first, but then Peter Annebeck is the other one. Bengt but Bengt the third, but you don't have to forget that Luigi Barducci was really the one who introduced me to the research field, to neurology, and to epidemiology. I was working with him with epidemiology, and you have heard some nice stories by Stefania. And Stefania was really the person that I have met in that period. We met in a fantastic place in Taormina the first time. I will never forget about that. But anyhow, and with after this first meeting, we have continued for many years. But then, of course, comes the period, and I moved to Sweden, and Bengt has been there. But Bengt, now the picture is put on the first moment when I met you, but you have been following the whole period, so I should have put back all periods. And with him, I did my thesis, fantastic period. I felt like I was in vacation. Although I worked more than 10 hours per day, but it was fantastic. And through Bengt and through the work with the thesis, I met other people that were special. One is Cecilia Annerholm and Eva von Strauss. Impossible to have done all the work that I have done with Consoming Project without their help. And the other key person was Sven-Erik Ronell, at that time the director of Centrum. We worked really very closely, very nicely together. And then comes the period where I started to go a little bit on the international arena. And there was a journey where we put together with Walter Rocca. You see that man up there with the beer? This is Walter Rocca some years ago when we worked in Eurodem, but we have met already before that. But this was our journey in the international arena. I think also for you.
Is it in Firenze?
I think it was in Rotterdam. What is Rotterdam? And here, maybe you don't recognize, but all these are eminent researchers in the dementia field. At that time, we were all very young. It's Carol Brain, is Mortimer, Jean-François Dartigue, help me, Walter, Anthony Jorma, Leonor Launer, Antonio Lobo. So people who has really done all the work during these years. Monique Brettler, you are right, Monique Brettler is there too. Yes.
Albert Hoffman.
Albert Hoffman on the back, yes. Okay, so this was my first international journey. But then I came back to Sweden, and then I have I was so lucky to meet another important person who has been following all the period after the second period of my stay here in Sweden. That is Maria Wallberg. Where are you? Without you, we'll not have snack. Because, it was essential having your contribution, as well as the new Centrum, because when Eric Ronell was on the way of going, and now we have the new director, Rosa Hedberg. Thank you very much for the work that we are doing together, thank you. And then, of course, all the people doing the data collection stack. Fantastic people, some of them, they were from the beginning. Gunilla, I take on your name, Gunilla Thorhagen, and not all the others, but we have physicians, psychologists, and nurses doing a fantastic job with the data collection. And then, of course, there was the whole group, because at the national level, because SNAC is not only in Konsummen, but there are also other 3 centers. In the south part with Sölve, in the north part, unfortunately, Anders Schwimmer has left, but he is here, and then in Blekinge, that I think is, Johan is the tall man there in the middle, in Blekinge. So, fantastic, and right people to meet, to do a good job together. And then, approximately the same period, we started ARC. And here we have other people that were essential. Matt Turslund, Miyaki Vipetto in the first or second child, what was that? You don't remember. Or Lars Beckman, Christina Ionel, Johan Fassbund, and Marty Parker. Unfortunately, she left too early. She has been crucial for the creation of ARC. And of course, then ARC has had also other leaders, and I have Laura Fratiglioni and Karin Mennerson. Thank you for the work that you have done after and now. Other journey, it was thanks to all the people working at ARC as students or as visitors. I cannot put a picture of all, so I took one of the meetings that we have in my house, I think. But one of the visitors was Patrizia, and she has already told us, and she has been so happy with her stage with us, and now she's affiliated to Karolinska. I mean, we understand, we are really doing pledges here. And then international journey continue, and this was thanks to Amaya Calderon and Davide, that they have taken me in the multi-mobility field. And here we have, you see this nice smiling man. This is Luigi Ferrucci, but unfortunately he couldn't be with us today. He's really sorry for that, and we are more sorry than him, but I want to show you. And that was a group of eminent geriatricians in the world. Of course, Maria-Erik Stotter was there. Do I have to mention some? Again, we have Marengoni, Professor Marengoni there. Okay. This was the international journey, but I have not finished with my journeys. Then we go to a little bit closer, 2018, near. And again, Deborah Rizzuto, but another important person, Linnea Schöner. Thank you. Impossible the work that we have done without these two girls. And then I have the pleasure to start working with the Fondazione Ferrero that has healthy aging, who was one of the pillars of work, and they do every 2 years, they organize a Healthy Aging Week. We will be in Alba next week, and it's really a pleasure to work with Ettore Bologna, who is also very happy I think he's listening to us in this moment. And one of my last journey has been in gym, and we have Bo Angelina, who's the chief editor, and it's a pleasure to work in that group. When really you learn a lot of things, so it's an advice for you to think about. Also, this journey is very important. Last, not least, is my engagement in another international group of experts concerning anti-ageism alliance. Luigi Ferrucci is also in this group, and there has been really a new topic for me. I started to work with ageism in the last 3 years. I am lecturing on that because I'm convinced that is very important. So that was my way to show you the journeys, and we have to speed up to the end because I want to show you the very personal. Here we are only in the personal. So I am still surprised for having had the courage to catch all those trains. I don't know how I did it, but I'm proud for having been and having done this, and it has been a work, but especially has been a pleasure and a privilege. The very personal are 2 points only. One, I have enjoyed also our social life at ARC. Let me tell you to everybody here, I have enjoyed all our PhD parties, the summer excursions, Ben's house get-together, the ARC days, and even the Christmas lunches. Okay, and at last, but not least, the families. Because if I've had a multiple journeys in my professional life, I cannot tell you about the private life, so that I will not tell you. I show you only a picture where you can see, starting from the left, my father with my son, the man of my life, my mother with my son, a fantastic bonus daughter, the Swedish family, a large Swedish family with my friend Giovanna, the Italian family, the enlarged Italian family with a lot of friends, and the community in the village where I was born, Montemassi. You have absolutely to go there once in a life. And we have a KI representative who has been there. Thank you. So, all these people that have done the journeys together with me, we have done nothing of what I have done could have been possible, and this is my way to thank all of you. Thank you.
Another one is coming.
Wow! Ooh. I don't know my passion from flowers. Grazie per la caffè. And the centrum, of course. There was a period where we were in the same house, and we called ourselves the House of Aging Research. That's a very nice period. Okay, thank you.